All right, we're going to move on to the hemoflagellates, including the trypanosomes and leishmanias. Now, all in all, these are fairly low yield. There's one trypanosome that I would give medium yield status to, and that's Trypanosome cruzi. These organisms infect the blood and the tissues, and typically the disease follows the inflammatory response to the amastigotes. So again, you've got these listed in tables, and I'm going to go down the table, and first starting with Trypanosome cruzi, which is probably, of all of these hemoflagellates, the most high yield. All right? Now, you have to know the vector. In this case, the vector is called the reduviid bug, and here's an image of the reduviid bug. It is also sometimes called the kissing bug or the cone bug. And what happens is it passes feces when it bites the victim, and as you scratch that bite, you're actually implanting the feces at the site of the bite. The reservoirs are domestic animals, but also armadillos and possums, and is very high incidence in Latin America. So again, if they mention that in the case or the vignette, that's probably a good clue. You are not expected to diagnose these depending on what the organisms look like, but the bottom image, I'm showing what Trypanosome cruzi would look like in a blood film. But it's really nondescript. It looks like a lot of the other trypanosomes, so they're probably not going to show you an image of it and expect you to know what that is. Now, the disease is called Chagas disease. And one of the early signs of Chagas disease is called romanicine, which is some periorbital swelling. So that's a common early sign of Chagas disease. The other target organs, what I want you to think about for Trypanosome cruzi are the C's. Okay? C for cruzi, C for Chagas, C for children, C for cardiac, okay? And if you want to extend it to the cone bug, you can have a C for that as well. It can also cause toxic megacolon that starts with a C. So you got to remember the disease with all the C's is Trypanosome cruzi. Now, so causes myocarditis when it affects the cardiac muscle, but there are other target organs also involved. And the disease, as I mentioned before, is an inflammatory response to the amastigotes in the tissues. What I'm showing here is something called xenodiagnosis. And sometimes they'll do this in developing countries. In order to diagnose Chagas disease, they will take reduviid bugs that they know do not have trypanosomes, and they will put them on the patient underneath this little cup here, let them bite the patient, and then they would take the reduviid bug and look for the trypanosomes in the actual insect. That's called xenodiagnosis. We don't do that very often, but you can see that sometimes in developing countries. So we're going to diagnose it with blood smears, and you're going to see the little trypanosome, and it is treated with the drug of choice, which is nifurtimox. So that's Trypanosome cruzi. Keep in mind the next two trypanosomes, as well as the leishmanias, are really fairly low yield, okay, for step one. Now, Trypanosome gambiens and rhodiens correspond to West African and East African sleeping sickness. And these are both transmitted by this lovely little guy we see in the image here, which is the tsetse fly. So the reservoir are other humans and animals, and the vector is going to be the tsetse fly. And again, you need to know the vectors for all of these diseases we're talking about. So if you know nothing else about East and West African sleeping sickness, you should know the vector. All right, what's the disease? African sleeping sickness, where you get a blood disease with fever, chills, anorexia. It can look similar to a malarial-like disease, okay? But East and West African sleeping sickness. Diagnosis is going to be by blood films. So again, you're going to find little trypanosomes in the blood films. But again, you are not expected to recognize that to make a definitive diagnosis. Treatment for trypanosomes, for acute sleeping sickness, you can use Suramin, or for chronic sleeping sickness, you can use Melarsoprol. And those are two different treatments that you're going to use depending on the stage of disease that the patient has. Now we're going to move on into the leishmanias. Leishmanias are all transmitted by the sandfly. So again, we want to know the vector. We have different forms. We have visceral, we have cutaneous, and then we have mucocutaneous leishmaniasis. So what I'm showing up here, of course, is visceral leishmaniasis with the causative agent Leishmania donovani. And again, what you can see here in this man and this child, you have the outlined hepatomegaly or hepatosplenomegaly. So that is visceral leishmaniasis or Kala-Azar. Most patients are going to have this mild or asymptomatic infection, but with the pronounced hepatosplenomegaly. So that is characteristic of visceral leishmaniasis. Diagnosis, you're going to look for the amastigotes in macrophages in the bone marrow, the liver, and or the spleen. And the treatment is stibogluconate sodium is the drug of choice for leishmaniasis. All right, we're going to move on to cutaneous leishmaniasis, which again, transmitted by the sandfly. And you're essentially going to get an ulcerating skin sore at the site of the bite of the sandfly. And most of them will heal spontaneously. Here's another example of the ulcerating skin lesion, okay, at the site of the bite. And again, stibogluconate sodium is going to be your drug of choice. Now, by far the most severe leishmania is mucocutaneous leishmaniasis. And the species associated with mucocutaneous leishmaniasis is Leishmania brasiliensis. Mucocutaneous leishmaniasis, as you can see in this image, completely restructures the face, the hard and soft palate, as you can see here. This is another image of mucocutaneous leishmaniasis, where you have one or more primary lesions at the site of the bite and then disseminate, completely again restructuring the hard and soft palate. Diagnosis, again, just like for the others, you're going to look for the amastigotes, and the treatment is with stibogluconate sodium, again, as your drug of choice.